So my name is Maritza Arellano. My topic for discussion will be cancer in the elderly group, specifically with colon cancer. Colon is currently the fourth most common cancer diagnosed in the United States. Most diagnosed colon cancers are found within the ages of 50 to 60 years old, and those numbers are expected to significantly increase over the years due to the growing population of older adults. So one view is that cancer develops in older people simply because of their prolonged exposure to carcinogens such as sunlight, radiation, environmental chemicals, and substances in the foods that we eat. Statistics show that men have a 1 in 2 chance in developing cancer during their lifetime, while women have a 1 in 3 chance. While weight, diet, exercise are more significant risk factors for developing cancer, race and ethnicity do have some influence. According to the American Cancer Society, African Americans are more likely to develop and die from colon cancer than any other ethnicity. Although no one wants cancer to directly affect their lives, it is important to know that there is hope for remission if diagnosed. So those ranges go anywhere from 80 to 95% in stage 1, 55 to 80% in stage 2, 40% at stage 3, and the last and final stage of cancer is stage 4 with the 10% remission range. So the key to successful remission is a positive prognosis. Prognostic information is necessary for patients to fully understand their likelihood of their disease. Cancer treatments like chemotherapy can be extremely difficult on the body as they can sometimes destroy healthy tissue along with the cancerous tissue. Eating well and maintaining a nutritious diet is one of the best ways you can prepare for and recover from colon cancer treatment. The increased caseload of older patients with cancer will present a great deal of challenges to all components of the healthcare system. Proper prognostic education is key to prevention, monitoring, and successful treatment of diagnosis. Conversations about prognosis are necessary for patients to be fully informed about the likelihood of their disease. A positive and well-informed prognosis could alleviate patients' anxiety regarding their cancer diagnosis. So for the intervention, we will be working side by side with the client's oncologist and registered dietitian to know their prognosis of their disease. We will create a grocery tool app through the Pinterest application where clients can better educate themselves on proper cancer care treatment. The tool will consist of articles on prevention, monitoring, and treatment, as well as menu plans for each stage of the diagnosis, since every patient is different. It would also provide tips on proper food choices and their nutritional benefits. So here's just a quick view of what you should eat. So the plate shows more than half, so 2/3 or more should be vegetables, fruits, whole grains, or beans, and 1/3 or less should be of animal protein. You can see that there's a rainbow, so eat a lot of starchy fruits and vegetables, and water. Hydration is key to successful treatment. So to further go into it, so what to eat is a lot of whole grains and cereals. If possible, it is recommended to go meatless, but if you just don't want to do that, we suggest choosing lean meats such as healthy omega-3 fatty foods, such as wild-caught fish. Also choose high-calorie, nutrient-rich foods such as avocado, nuts, beans, and seeds. It's also very important to eat small meals throughout the day and to keep your favorite foods close at hand, even though you don't have an appetite, because some patients will experience a loss of appetite due to the chemotherapy. It's also, like mentioned before, it's also very important to stay hydrated because a person may lose a great deal of fluid or electrolytes during treatment, which can make it much more difficult to recover. So, what not to eat. Some cancers temporarily weaken your immune system, so it's important to avoid germs that can make you more sick. So some of those include avoid unrefrigerated eggs. If you cook meat, you got to cook it fully well done. Avoid any perishable foods such as raw kombucha. Avoid processed and red meats. Limit your high sugar sweet drinks, and also avoid salt, like high salt preserved foods and fast foods as well. So for the monitoring and evaluation, nutritional assessment will be done through clinical, dietary, anthropometric, and biochemical measures every 2 weeks. We will, like mentioned before, we will be working side by side with the oncologist and their dietitian to know the results of the lab work to ensure that the patient is meeting their nutritional needs and can continue for their next scheduled chemotherapy treatment. The dietitian will also discuss the client's food choices, water intake, physical activity, and just overall concerns since the client's last visit. Examples of how we will know if the client is following along and doing their work too will be examples of documentation through the Pinterest app, such as pins of their home cooked meals, recipes they have recreated, or just pins they have linked from other boards that they've managed to come across of. The application will also show like herbal supplement recommendations for nausea, sickness from the treatment, such as ginger and chamomile tea. So they'll know those little tips that, to prevent the nausea. And also, like with approval of the client, the Pinterest boards will be shared with other undergoing cancer treatment patients for more love and support from their own cancer community. So here's a couple examples of how the tool will look. So we broke it down to three different boards. First one is going to have cancer care and lifestyle pre-treatment. So everything you need to know before going into cancer. So how to stay hydrated, tips to keep your immune system strong during chemo, tips on how, to pack for chemo, the radiation, the side effects, just everything that just might happen, Also there's a cool one that's starting chemotherapy, so 15 nutritional tips. So they can just navigate that. And as well as if they're during chemo already. So that one is going to have all your foods, all the diets, foods to keep you hydrated, some tips on how to stay hydrated, such as smoothies, infused water, anything from high fiber foods and plant-based recipes, just everything the client needs to know about how to nourish your body during and after chemo. So that will be really cool for them. They can do the ginger mint anti-nausea lollipops, keep those at hand, just anything that they need. And then the last board will be their cancer care and lifestyle post-treatment. So like in the other board, how to nourish your body during and after chemo, because just because you did chemo doesn't mean you're done. Like you still have to wait, I believe, a year, and then they check you again to see if the cancer is all gone. So foods that you can help, prevent cancer from coming back, it'll all be listed there. Your top 12 anti-cancer foods, your anti-cancer superfruits, smoothies, everything that you need will be just right there at the palm of their hand, which is really cool. They don't have to go out of their way to get all this information. It's just as simple as just logging into their phone. Oh, sorry. That is the end of my presentation. If there's any questions or concerns, feel free to ask, feel free to me. But here are the references for my project.